You ever see Indiana Jones and the Temple of Doom growing up?
Yes. Hmm.
Okay, scarred me for life. That and Poltergeist. Long story, won't tell you that one, but um Indiana Jones and Temple of Doom, the guy grabs his heart like with his hand. Do you remember that? And like pulls it out of his body. And I was like, what in the world is happening? It's like
Yes, I do
trauma,
remember that.
childhood trauma, folks.
This is On Call.
Wow, this would be really cool to just wear scrubs all the time. Then you don't have to think about what you're going to wear to work.
Joke is awesome. We're here to answer your questions. We can sit down and discuss them. Wait, I gotta go. I'm on call.
Wait, you're on call? I thought I was on call. Hey, everybody. Welcome back to On Call with April and Alicia. I'm Alicia.
I'm April.
And we're happy to have you guys back in February.
Yep.
Still cold. April, how are you?
I'm good. We actually had this like really bizarre day the other day where it was like 50 degrees.
Oh, gosh, yes.
And that's like, I don't know. That's just how we are here in Maryland. But we're snow, like 20s, 30s. And then it was like, here's a 50-degree day. And now we're back to the coldness.
We had something similar. I think it was actually, I want to say it was like 60, 61, 62, somewhere around there that I was like, what in the like global warming is happening right now? And now it's 17 degrees. So
yeah, we're the same. Now we're cold again.
it's a mentally unstable Mother Nature right now. She needs a straitjacket.
Yeah.
What's going on in
it's
your
hard to
world?
know what to like
Nope.
put the kids in and all the things,
I know. Well, it's like, hey, so put like shorts on, then put pants on top of your shorts, and then put a short sleeve shirt and a long sleeve shirt
Yes,
and a jacket, and then
layers.
you could just strip through. Yeah, it's really frustrating. But our little buddy, Punxsutawney, when he didn't see a shadow, is that right? Yeah.
Yeah.
That's what that means. Yeah, I always forget that part. Like, is it he didn't see it, but whatever it is, it
wait.
means it's going to be more of this.
Yeah, we're
More
gonna
of
have more
this.
winter. I think
Whatever
he's
he
right.
did, it's more of it. Yes.
Yeah,
And we don't believe him. So, although
I
I do
do.
believe him in this setting.
I do
So you
believe
might
him.
have
I
won
think
that
he's
battle.
right this year.
What's going on with you guys? Anything fun in the Burke household?
Not really. We have basketball playoffs this weekend, so hoping that they do well with that.
Nice.
And that's it. Been doing some traveling for work, getting out, visiting some of our sites, and doing some presentations at schools, which is always fun. I love to
Yeah.
talk to our like PA and NP students about what we do at Sound. So
Like good recruiting.
yeah, it's
Nice.
fun. We did.
I
I
have-
actually did a trivia with them, which was really fun. I mean, there's nothing like a competitiveness in a classroom.
Yeah. Well,
So it
I
was
love
fun.
competition, April.
Yeah,
That's my love language.
I know.
Competition. I only thing happening with me right now outside of the weather. I talked about my Roomba before.
Yes.
Okay. I have all these videos. I feel like I've have this compilation of videos as if it's like my first child. Like,
Of
like
your
I should have like a
Roomba?
first child book because I can't figure out how like goofy it is. So the one I was telling you about that came on like a couple episodes ago, like 3 a.m. randomly, or just goes in circles, like for no reason. Like it's just the weirdest things. I got to a point where I got so aggravated with it. I picked it up and threw it away. Like walked it out to the garbage can, threw it away. It was probably also in the middle of a work day where I was slightly distracted because I was distracted enough to not remember I threw it away for a little bit. So then I was searching the house looking for it. Like, let's just say 4 or 5 days later, I'm like looking everywhere, under beds, like in closets, underneath, like,
Wait, you threw it away and then you were looking for it?
yeah, but I was saying I threw it away, I think in the middle of a work day because it was
Oh.
frustrating me. Like I picked
Yeah.
it up, threw it in this box that was sitting in my house, that had like all this other garbage. Like I was collecting like old like gift bags and like a bunch of stuff to put out in recycling. So I had this really big box sitting at the garage door. So I like it angrily must have just thrown it in there and then forgot a couple days later I did that. So then I was like, see, this thing's so dumb. Like I can't even find it. And I was like, oh, I threw it away. Then I did remember. So I ordered another one overnight. This one
Oh my
might be
gosh, you're
sillier than
so
the first one.
ridiculous.
But I have videos to prove it because I'm telling you, it is almost on its own suicide mission that I can't figure out. It
Is it
is
trying to like
committed to finding
kamikaze down the
havoc.
stairs?
Yeah, it is like there's this gap in my fridge, and I don't understand. Like it loves the gap, but it like intentionally forces itself up under the fridge, and then it like alarms that it's stuck. I'm like, no crap, it's stuck because you keep going there. But I keep talking to it like it's an adult. I have so many freaking videos, April, you would never believe.
Oh my goodness.
Like, and why I think these things are human, I don't know. I have no idea. But they are entertaining, but they not in the it doesn't bring out the best emotion of me. It's actually really quite frustrating. So, we got new version 2025 Roomba.
I think you need
Um,
to get out of your house more.
I think you might be right. I think you might
I
be
think
right, but
this
this
is
one I
a
like
sign
'cause
of
it's
like,
got
I
like a
mean, you're gonna
mop on it
become like
too.
instead of the crazy cat lady, you're gonna become the crazy Roomba lady.
I am
You're
going to
gonna have
be,
a
and
whole army
I
in your
accept it.
house.
I accept the mission. It's
Oh my
just
god.
it is if I show you the videos, you're probably gonna laugh. I'm gonna put them up, I promise. I just want to like string them all together so you could see like pre 2025 Roomba, RIP, and then like our new one. It is it is actually a sight to be seen, and it's really funny. I my kids will be like, why are you watching it? I'm like, I'm just going to see what it's about to do. It's like I'm watching somebody do yard work or something. I don't get it. Like I don't know. I've got this like weird obsession around it. So that's
Hmm.
the only thing interesting in my life. And guess right now it's hanging on the side of the like ledge to go down. Like we have this drop down like overlook area that like drops down a floor, and it's right on the ledge where it's been for the last 24 hours because now I feel like it's in timeout. It has got its own personality and it's like a child of mine. I don't know. And the kids will be like, "Mom, go put it back on the charger." I'm like, "It's fine. It put itself there. It needs to stay there for a minute."
Oh
I
my
don't know. There's
goodness.
something wrong with me. I need help majorly.
Yeah, you need to get out of your house.
Shut up, April. I know. I
We
know.
still have yet to buy a Roomba in my house.
Well, don't because
I'm
it
not
might
gonna.
frustrate you. Actually, maybe I'll just like buy one for you so that you can feel my pain.
Yeah. Well, do you remember when I sent you that picture of like somebody that made theirs like a ghost at Halloween? I fully expect a video of that this Halloween from you.
On the Roomba.
Yeah.
I can't wait. I
I
wanted
think
to
they
do
put
Elf
like a
on the Shelf
broom
on the
with a sheet
Roomba.
over it or something and made it a ghost.
It's really funny, but I'm gonna strap Elf on the Shelf next year. I've already decided. I'm gonna strap Elf on the Shelf on the Roomba, and I'm gonna send it into my kids' rooms while they're sleeping, just to be disruptive. Like 2 a.m., 3 a.m. I'm gonna schedule
Will they know?
it. Will they
My
not
kids
hear
would
that thing coming through their
my
door?
kids would not. My kids sleep so strong, so wow, soundly that it wouldn't wake them up.
Are you kidding?
No, I'm not kidding.
Okay, well, we could talk about this forever, but last episode we did like an honor of Black History Month, and we're still February, and I think we could dive into a topic that literally keeps us all going. Dudunk. It's Heart Month. Did you like that joke?
I did. That was
Thank you.
great. Took a second to
I'll be here
register,
all
but
night.
you know.
So, like, whether you're a healthcare professional or a patient or just somebody that's trying to keep in shape and they keep their heart in shape or whatever, like this episode's going to be for you. So, one thing I would like to say is heart disease still remains the leading cause of death worldwide, but there is good news. Many cardiovascular issues really are preventable, right? With the right knowledge and the right lifestyle choices. So February isn't just about like we just had Valentine's Day that passed. It's not just about chocolates and Valentine's Day, but it's also a time just to show some love to your own body, your own heart. So today, I think you and I should put our cardiac knowledge to the test with some challenging and surprising, maybe even mind blowing heart related trivia. What do you think, April Burke?
Let's do it.
Okay.
I have red
So,
on, my shirt's red in honor
do
of Heart
you?
Month. I do.
Oh, you're gonna have to share the shirt.
Yeah.
All right. Well, let's do a little heart trivia. And how about you start?
All right. I'm gonna start with two truths and a lie.
Oh, you're stealing from Alicia.
I know. I like it because maybe you'll get it wrong. So, I have to get
Oh, whoa,
my
whoa, whoa,
sticky
whoa,
note
whoa.
ready.
That's right. It's our sticky note, sticky note, sticky note. And I believe April, we're 2-0 right now, right?
Yeah, I'm winning.
Oh, no, 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 no. You're not. That's one thing I do pay attention to. Maybe not the
I
Roomba, but I am
know.
paying attention to the score.
Of course you are. Of course you
Okay,
are.
so I'm 2-0, and we'll make it 3-0 by the end of this episode. Let's go.
All right. Are you ready?
I'm ready.
Okay. Two truths and a lie. So you have to tell me which one is the lie.
Okay.
Runners have a 45% lower risk of heart disease or stroke. The average size of a heart valve is about the size of a quarter.
Hmm.
Or the heart pumps on average 4 tablespoons of blood out every heartbeat.
Tablespoons?
Mm-hmm.
I'm going to say it's C.
Nope. You are
Am I wrong?
wrong. You are
Really,
wrong.
tablespoons just sounded really like not enough. Like
Well,
maybe that's what's wrong with my brain.
yeah,
I'm only
maybe.
getting 4 tablespoons of blood to my brain. No, just kidding.
So
All right,
you
tell me
were
why.
wrong, which makes me super happy, but
Oh, that's mean.
I'm just kidding. The correct answer was actually B,
Wah,
about
wah.
the size of the heart valve. So the
You
runner
said a
piece of it,
quarter? That was the thing, right? It was a
yeah, I said
quarter?
a quarter. It's actually a half
Oh.
dollar.
Oh, Susan B. Anthony. No, wait.
Yeah.
Is Susan B. Anthony a half dollar? I think she might be a dollar. Whoops. Whoops. We'll fix that one in March, everybody. Keep going.
All right. So the fact about runners is true. They do have about 45% lower risk of heart disease or stroke. And we do typically each heartbeat pumps approximately 4 tablespoons of blood.
Okay.
But if you look in a minute, we pump about 1.5 gallons of blood. So if you think about it, that's a pump rate that could fill an Olympic-sized swimming pool in less than a year from just our heart.
Holy moly.
I know, and then the valve is actually a half dollar, not the size of a quarter. So I tricked you.
You did trick me. And I promise we'll follow up in Women's History Month on Susan B. Anthony. Sorry, Susan. I think she's worth more than a half dollar, actually. Okay. All right. Well, so I'm a 0. I've got 0. You've got 0. Okay, we're both tied. Perfect. All right. I got a true. I'm gonna go true or false.
All right.
The heart has its own intrinsic pacemaker and can continue to beat even when it's disconnected from the body. True or false?
Its own pacemaker?
Yep, it says the heart has its own intrinsic pacemaker and can continue to beat even when it's disconnected from the body.
I think it's true.
You said true because you're a cheater. But yes,
No,
you're
I
absolutely
said
right.
it's
Tell me
true
why you
because
think it's true first.
our heart has its own electrical system. The word
Yes,
pacemaker threw me off for a half
that's
a
why I
second
did
there.
it.
But we
I
have our own
did it to
electrical
throw you
system in our
off.
heart that that makes it work. So it
Yes,
is
you're
true.
actually correct. Do you know what it just reminds me of? When it's like when it's disconnected from the body. Did you ever see Indiana Jones and the Temple of Doom growing up?
Yes. Hmm.
Okay, scarred me for life. That and Poltergeist. Long story, I won't tell you that one, but um Indiana Jones and Temple of Doom, the guy grabs his heart like with his hand. Do you remember that? And like pulls it out of his body. And I was like, what in the world is happening? It's like
Yes, I do
trauma,
remember that.
childhood trauma, folks. That's like the stuff I was watching. But yes, it actually is very true. The SA node, it generates electrical impulses independently, but without circulation, here's the tricky part. The
Yeah.
heart will stop due to lack of oxygen and ATP depletion. So it can. This is how we are actually like able to, take hearts out, then transplant, but it's not going to keep beating for too much longer once it's removed. So
Right.
it's interesting.
It is interesting.
Yes. So you're winning, allegedly.
That's awesome. It's a great start.
Well, this will be our sympathy episode. How about that?
Oh, I
I
don't
know.
like it anymore.
I know.
All
Okay.
right.
You're next.
Okay. Um, so heart disease, so this is a true or false.
Okay.
Heart disease is the leading cause of death for all men and women. True or false?
Heart disease is the leading cause of death for all men and women.
Hmm.
I'm going to say false.
in the United States. You're correct. That is false. So it
Boop,
is
boop, boop.
true for, well, why did you say false? I'll ask you why.
Because I know we talk about like it's women's heart. We hear a lot about Women's Heart Month, so I just assumed it had to be women had to be at higher risk.
Oh, okay. Well,
What?
it's actually false because
Oh,
so it's the leading cause of death for people of most racial and ethnic groups in the US, however, which includes African Americans, American Indian, Alaska Native, Hispanic, and white men. But for women from the Pacific Islands and Asian America, American Indian, Alaska Natives, and Hispanic women, heart disease is actually the second leading cause
oh
of death,
wow.
and it is second to cancer.
Oh, that stinks. Any specific cancer or no?
No, just I think cancer in general.
Yeah, in general. Okay. Okay. Well, we got work to do, women. This is why we're doing this episode, right?
That's right.
All right. So I'm kind of digging the true or false. So I'm going to get you a rapid fire April Burke. Ready? True or false? The left ventricle pumps more blood than the right ventricle. True or false?
True.
False. We are
What?
tied officially. Both ventricles pump the same amount of blood per beat, period. However, though, the left ventricle generates more high pressure due to systemic circulation resistance, but that's it. They still pump the same amount of blood.
Hmm. I guess
Right.
that makes sense.
All I did, I had to like trick you really fast. I was like, I'm going to find the hardest question I've written down so we can be even.
I don't like you.
So,
I don't like playing games with you. I like you. I don't like playing games with you.
everybody, you heard that April doesn't like me. So,
I just took it back and I said I
we are
did like
accepting
you.
applications for new co hosts currently.
Does that mean that you're going or I'm going?
I don't
That's an
care.
interesting
At this
question.
point, you don't like me. I'm going to cry. Okay.
Hmm.
On
All
you,
right.
my friend.
Okay. True or false? High blood pressure can be referred to as the silent killer.
True.
So you are correct. It is true.
Of course, I'm
So,
correct.
of course. So I think that people sometimes think, oh, well, if I have a high blood pressure, I'll know because I have symptoms, but you may actually never have symptoms of high blood pressure. So don't wait for symptoms. The only way that you'll really know is to get your blood pressure checked. And early treatment of high blood pressure is really critical because if it's left untreated, it can cause heart attack, stroke, kidney damage,
Mhm.
and other serious health problems. So this is my pitch for everybody, regardless of your age, to get a physical at least once a year. So
Yep.
I know so many, we've working in the hospital seen so many young patients over the years come in with abnormal labs, abnormal vital
Yep.
signs that they had no idea because they're asymptomatic, but are actually super sick and had no
Yeah.
idea. So,
And you can go to like your most like neighborhood pharmacies. You can go to the back by the pharmacy and check your blood pressure yourself. Just know the normal ranges too. You don't have to wait once a year for that doctor's appointment.
correct.
Yeah, I like that one, April. I'm going to give you an easy one because this is one I just want to talk about in general. So
All right.
hang on to your hat. And then I'll
Okay.
just keep us even, because you'll get this right. Then we'll at least be even. Okay. True or false? A heart attack always causes chest pain.
False.
Right. We know this, but this one's important to me. Really, like many heart attacks when people come in, especially with women. So we're talking about Heart Month, women, diabetics, they can present atypically. So you can have like we think about like that crushing chest pain, like, oh, like I have this pain in my chest. How many patients, April, have you well, you may not be able to count them, but how often do you see patients that come in that have had MIs, that or heart attacks that they really didn't have chest pain when it was happening?
Oh
What were
yeah,
the
we see it
things
all the
that
time,
what were the
right?
things that they said to you, but that were their presenting symptoms?
Oh, I mean, it's general, right? Like they'll be short of
Hmm.
breath when they're moving around, or they
Yep.
feel kind of weak or fatigued, or they just like
Hmm.
don't feel right. You could just be nauseous, like feel like you're gonna vomit.
Yep.
It can be really
Atypical like
general symptoms.
jaw pains. Like
Yeah.
how many times have we heard about jaw pain, back pain, like referred pain? You said shortness of breath, and that's like sometimes shortness of breath without chest pain. There are really so many things that I would love to just like really drill into our listening audience if you're non-medical to know that that it can even show up as like dyspepsia. It could like heartburn. It could feel like
Right.
heartburn. Sometimes it just feels like heartburn. So if you're experiencing something sudden out of the blue, like just make sure you get that checked. But not all heart attacks show up as the way we see them in movies. So
Yeah.
it was really one that I was willing to give a point. You're welcome, listening audience, that I gave a point to April for this one, but your lives mean more than me winning. So this is an important one, and I don't know that we even talk about this one enough.
It is
But
important. And you said for, non-healthcare providers, but even healthcare providers, especially if you're a new
sure,
provider listening, don't discount some of those general symptoms in people
yeah,
who have risk factors. So,
absolutely, absolutely. So important one. All right, let's go last round here.
all right. Well, I think this one is going to be an easy one for you too, but I actually think it's
Good,
something
yes,
important
keep
to
it even,
talk about.
Steven.
So, these ones are hard to make hard because of our medical knowledge, but true or false? Patients who are having leg pain is never associated with heart disease.
Say that one more time.
Patients having leg pain
Leg pain.
is never associated with heart disease.
False.
That is false.
Tell me about
So, I
it.
think that, and I think this is important to talk about because we typically think of, leg pain as something like, oh, I probably just pulled a muscle or whatever, I just sprained it. But actually, if you have leg pain, that it especially occurs like after walking for a little bit or exercising, it could actually be a sign of a condition that's called peripheral arterial disease, which is where you're
Mm-hmm.
having blocked arteries in your legs caused by plaque buildup. And this is actually a risk factor for heart attack and stroke because if you're having those plaque buildups in your legs, you could also be having plaque buildup in your heart. So
I love that
definitely
you
some
bring
to
this
think
up.
about.
Sorry to cut you off, April. I love, this is kind of along the lines of that, like previous, true or false. I love that you're saying this because we do kind of compartmentalize our bodies, don't we? Like
Yeah,
what
yeah,
happens in the legs are the legs. What happens in the heart is the heart. And what happens in the brain is the brain. But if we've got vessels in the heart that can get plaque buildup, we have vessels in the brain that can get plaque buildup, and we have vessels anywhere we've got vessels. It just like the body just doesn't go like, I'm only going to go to the heart, you
right.
know? So that's actually a really, really great question. And it's worth me getting it right for sure. But but seriously, like in all seriousness, these are actually really great topics for people to think about. The body just doesn't choose one area. They don't silo the way we do
Right.
necessarily.
Yeah.
I like
And
that.
some leg pain certainly still is musculoskeletal, but there is some that is not. So always
Yeah,
good to get, if you're concerned, always good to get checked out. So
absolutely. I like that one. Okay. So then mine is going to be well, we're going to stick with true and false. I like this. True or false. True and false would be funny, but true or false. Um, Stress increases the risk of cardiac events primarily through its effects on cholesterol levels.
you changed your word there. Say it again at the end.
Stress increases the risk of cardiac events primarily through its effects on cholesterol levels.
That's false
You're right. Why do you think it's false?
because it's not cholesterol. Your stress
Oh,
doesn't impact your cholesterol.
all right. Well, I was trying to throw you off. So yeah, stress can
I
actually,
know,
you're
but you
kind of
slipped up
wrong.
and said cortisol.
I know I did. And I don't know why, because cortisol's not even on my page.
I know.
It's one of those days, folks. So, both false. Stress can actually, April, indirectly affect cholesterol, just so you know. But with respects to the heart, its main cardiovascular impact is through increased like epinephrine and norepinephrine, which elevate the blood pressure and then promote endothelial dysfunction. So endothelial being the lining of our valves or our vessels. So it, it stress can impact cholesterol, but just not for the question I asked. So
Yeah.
I try to trip you up.
I was too smart for that. But in all
Ah,
seriousness,
you
heart
are smart,
healthy.
April.
I know I am smart. Um,
And wait. Before you close us, who won?
we were tied.
Hmm, I don't
Oh,
like that.
you're so sad.
I am, but I'm still winning. So I'm three and you're one. Okay,
No,
cool.
no, we don't count the tie. Like we're just
So we're gonna stay
you.
2-0.
Well, I guess you're 2-0-1, and I'm zero
Listeners,
zero
weigh
and
in.
one.
Who do you want to win this episode? Okay. No, just kidding. Sorry, April. I cut you off. I apologize.
No, you're all good. But also, in all seriousness, heart health is really important. So I know that we're,
Yeah.
playing a trivia game, but really, it is very important. We have seen it, many times with patients with heart disease and how the impacts that it has on them. So
Right.
it is extremely important, as I mentioned, to get your annual physicals. If you're having symptoms that you're concerned about, go see your healthcare provider, and just make sure in general that you're taking good care of yourself. We as healthcare providers are always talking about eating healthy and,
Right.
exercise and things like that. But it really does, as Alicia mentioned at the beginning of this episode, a lot of the heart disease that we see is preventable. Even in patients who have family histories of heart disease, there's still a lot that
Mhm.
you can do to maintain your own heart health, and prevent problems for yourself down the road. So take good care of
Okay.
yourselves, go see your healthcare providers on an annual basis at a minimum.
Don't ignore
And
symptoms that you don't
exactly.
think fit. Yes.
If it doesn't feel right, get it checked out. So,
Mm.
and
All
as
right.
always, thank you for joining us. We would love to hear any feedback that you have. If you have any suggestions for new episodes or any even questions and things like that for us, you can reach out to us at oncallpodcast@soundphysicians.com. You can also find us on Instagram at OnCall with April and Alicia. And please subscribe so that you know when our episodes are coming out. And
Yes.
thanks for joining us again.
Yeah, absolutely. And until the next episode, you guys stay well and we will stay on call. Have a
Bye,
good one,
everyone.
everybody.